It's been almost 4.5 years since Guam voters passed a referendum legalizing medical marijuana, and still there is no medical marijuana program in place. Acting Public Health Director Leo Casil says without the tools, expertise, and funding, there likely won't be one in place anytime soon. The former director of public health, James Gillen, retired because he said he did not have the tools or funding necessary to implement the medical marijuana program, and he was essentially tired of being forced to implement a program without the support. PNC spoke to the acting public health director to see where he stands on the issue and to find out when and if the program will ever be implemented.
Yeah, how can we operate something without the tools? So I agree with him on that 100%. Basically, we don't have the expertise. That's the basic thing. Especially the way it was run, right? And we don't have any knowledge on how to operate that, and no tools and so on.
It's been 4 years since voters passed medical marijuana. There have been 2 different sets of rules and regulations passed into law. Where does the medical marijuana program sit now?
For now, we're at a standstill. Actually, there has been no applications for lab or anything.
Casil says the lab is the major holdup right now. An independent lab is needed to test the medical marijuana, and the governor's most recent fiscal realignment plan actually defunds the lab. But Casil says this isn't much of a factor because the funding wasn't nearly enough for a lab anyway. In addition, he says the lab is supposed to be a private independent entity. So aside from the lab, what else needs to be done? Well, Casil says a tracking system must be procured in order to track the marijuana from seed to sale and prevent diversion. Database software must be procured to maintain patient and business information. A computer programmer is needed to oversee the maintenance of the tracking system and database. Inspectors are needed to inspect medical cannabis businesses in order to issue the permits to operate. A program coordinator is needed to manage the medical marijuana program. A clerk is needed to handle the day-to-day operations. And they need office space and office equipment. This is all estimated to cost around $1 million. The problem is zero funding has been identified for any of this. How long will it take to implement this medical marijuana?
Well, if everything's in place and everything's smooth, all the equipment, training, lab, we're hopeful 6 at least and up to a year. If there's no stumbling block on whatever, on the requirements or what.
But that's 6 to 12 months after you said the funding, the lab,
yes,
and the
as long as
personnel, and
if we have everything in place,
which are basically
the lab,
these things here,
yes,
which is the tracking system, the lab,
yes,
the database software, all that
personnel
stuff.
training, at least 6 to, let's say, a year.
After that stuff's in place.
Yes.
No medical marijuana program anytime soon.
Anytime soon, till we get all these necessary support, tools, and so on.
In the meantime, Casil says they are working on things that they can do, like developing all of the necessary forms. And he says he will do his best to do what he can to implement the medical marijuana program.